Welcome to IRG's Health Talk. I'm Tom Hutler, along with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy, and our guest, Dr. Thomas Degan, sports medicine and orthopedic surgeon from Premier Orthopedic Group.
Dr. Degan, welcome back. Thanks for coming back and joining us. Hey, I'm excited to talk to you. I want to talk about kind of these hip problems. But before we start talking about hip problems, injuries, fractures, etc., let's talk about the hip joint because it's a very interesting joint. Describe it for us.
Thanks for having me back. Yeah, the hip joint is what is classically called a ball and socket joint. And that means that the ball or the femoral head fits inside the socket, which is called the acetabulum in the pelvis. The hip connects the lower extremity of the leg to the pelvis, the trunk or body. And the ends of the bone in each instance, the socket and the ball, are covered with cartilage, and that's basically your bearing surface. What happens in older folks with degenerative arthritis is you basically wear away the bearings, and then hip replacements are basically new bearings. So that is a very quick synopsis of what a hip joint is. Besides the cartilage and the bone and joint socket, there is a labrum which runs around the hip. It's a fibrous cartilage, sort of like a meniscus in a knee, and that is a structure which can also get traumatically torn. And in some people, at this point, you can actually go in arthroscopically and repair that labrum and hopefully prevent some of the arthritic changes that can occur, and also get rid of some disabling hip pain, which reduces performance. And so a lot of times, if you're watching the sports shows, they'll talk about somebody had a hip tear and had surgery, and that's what that is repairing that rim around the socket. The other thing to talk about is the fact that the muscles are really what helps the hip function and move. They aren't as critical in a hip as, say, a shoulder. The hip's got a deep socket, the shoulder doesn't. If you do not have muscles around the shoulder, then you've got a lot of instability and other problems, not so much in the hip. So the hip is basically very stable. And if something happens to dislocate it, usually it's a big injury.
And if you dislocate your hip, you know you dislocate your hip.
That's correct. A shoulder, you can kind of slide it out a little bit, but a hip, if it's out, and you're not going to be going anywhere.
Yeah, and the hip is, like you described it as a ball and socket, very stable, has a lot of muscles, and there's big tissue around it. It also has a problem, and it's susceptible to some fractures sometimes, particularly in falls, and we see that in certain age ranges and populations. Describe hip fractures for us.
Well, the hip fracture is actually, the vast majority of the time, a fracture of the upper end of the thigh bone or the femur. And in describing that, to paraphrase the old song, the head bone's connected to the neck bone. The femoral head is the ball part of the hip. The neck is a tubular part of bone that attaches the head to the shaft or the length of the thigh bone. So the neck bone, in this instance, is connected to the thigh bone. The thigh bone, or your femur, has a couple knobs at the upper end. The big one, or the greater trochanter, is a bump on the outside of the hip, which is what you feel when you push the side of your hip area. And that's basically where the buttock muscles attach, and they're the ones that cause extension and give you stability, standing, abduction. And so that is what we call the trochanteric region, and then the area just below the trochanteric region at the upper end of the shaft is a subtrochanteric region. And those are the three regions of fractures. So the fractures are basically femoral neck fractures, intertrochanteric fractures in the trochanteric region, and subtrochanteric fractures, which are below the trochanteric region. The femoral neck fractures occur basically in two age groups. One is the younger athletic individual, and those will oftentimes be caused in a very athletic person by just overuse, a stress fracture. If you think of the bone as a living tissue that bends and extends just micro, but does, it will become more brittle and break if that happens too often. The body tries to repair it, but if the insult in the younger person by traumatizing it, weight bearing and running is too great and the body can't repair, then it will fracture. Just like bending a coat hanger too many times, the coat hanger will ultimately break. The hip will do the same thing if you don't give it rest. And so the thing you want to do is rest the hip if that's happening. And if you're having pain and active like that, you need to see your physician and get either an MR or a bone scan, depending on your circumstances, to figure that out. As you get older, you become weaker. You become less balanced and you can fall easier. So a key, again, talking about prevention, is to stay active. And oftentimes your therapist can help you become more active, get you stronger, help prevent falls. I'm sure, Shannon, you have a fall prevention program.
Absolutely.
As well as exercising.
Yeah, absolutely.
And that's key. And being active is key. There are some interesting recent studies for men, and with hip fractures, men have actually a higher mortality than women. The best predictor of longevity in men was actually how fast they walked in one study. In another study, the ability to lift heavy objects, in other words, being fit, was as great a predictor of mortality, a great as a risk factor as hypertension, obesity, and even smoking 2 packs a day. So staying fit is a very important part of hanging around here a long time.
Yeah, you make an excellent point about staying fit, because these hip fractures, these traumatic hip fractures you talked about, the 3 types, I mean, there's a fairly high mortality rate if this happens in the elderly population. We know that they don't recover very well sometimes.
That's true. And it's oftentimes a life-changing event where now you need more assistance, have to move out of the home, and all that. So that's important. Now, the most common hip fractures are what they call femoral neck fractures. That's between the ball and the trochanteric region. And these occur most commonly in women, and probably the biggest reason is osteoporosis. Mm-hmm. And this, again, is essentially a stress fracture. As you become more osteoporotic, you have less bone. And so getting back to the wiggling, sometimes just walking is enough to actually cause the bone to break. And if you talk to enough of these patients, you'll find out oftentimes what they say is, the hip broke and then I fell down. So you want to prevent the osteoporosis. And again, there's 3 basic ways to do that: diet, medication, and exercise. Exercise, weight-bearing exercise, walking, not swimming or biking, but weightlifting, walking are important. Medications fall into 3 broad categories. The over-the-counter things you can do are calcium, and women, menopausal, should have at least 1,500 milligrams of calcium a day. Vitamin D is extremely important, and in Seattle especially, as one endocrinologist told me once, we're all vitamin D deficient by February. So taking vitamin D is important. And we're not talking what you get in the multivitamins. We're probably talking 2,000, and if you're prone and dark and dreary, 4,000 international units a day are important. Having your primary doctor check your vitamin D level if you're at risk is probably very important. And then the third option are medications to actually treat osteoporosis, to try and prevent fracture. These broadly are bisphosphonates, which are the most commonly used ones, which act to slow the bone turnover down. And the other newer ones is Forteo. It actually speeds up bone formation. If you think of bone as like the Golden Gate Bridge, every 7 years you get a new set of bones. Just like the Golden Gate Bridge, every couple of years they get a new set of paint. They're always scraping, they're always putting down bone. Same thing happens in your body. You're always taking away old bone and you're putting down new bone. What the bisphosphonates do is they retard the taking down of the old bone, and the newer Forteo builds it up. It has some problems. You can only use Forteo a couple of years out of your lifetime, but it's a very important medication. The Bisphosphonates have been quite helpful in making the bone stronger and harder, but they make it more brittle. And the problem with that is that what we're finding is after 4 or 5 years of being on bisphosphonates, you can get, again, a stress fracture because the old bone, it becomes brittle, and you get a fracture in that subtrochanteric region, which is somewhat harder sometimes to treat and takes longer to heal. So if you do take bisphosphonates, you probably should take a holiday off them every 4 or 5 years to let the old bone get kind of cleaned up. So that's the medication treatment in a nutshell. The best thing for women, menopausal age and up, is to get a DEXA scan, which is a bone density scan, to find out what their bone density is. And it's also recommended for males over 70, because it can certainly happen to us as well. As testosterone levels go down, we become less active and all. So your primary physician should be able to direct you to somebody who can do a DEXA scan, and also have and also be able to either treat you or refer you to somebody that can treat you for medications if you are either osteopenic, which means you're getting osteoporotic, or osteoporotic.
Wow, good stuff. I mean, it sounds like as we wrap this up, I mean, the key is prevention. And if someone wanted to ask you more questions about treatment of hip injuries or fractures, how would they get a hold of you?
We're at the Premier Orthopedic Group in Edmonds, up in the north end. Our number is 425-774-2636, and we have orthopedic surgeons. We also have a rheumatologist and a nurse practitioner that are interested in bone health if you have questions about that.
Great. Thank you for your time.
If you'd like more information on this topic, as well as how to contact Dr. Thomas Degan from Premier Orthopedic Group, go to irgpt.com and click on the For Health tab, or go